Hello everyone. So in this video we are going to talk about hemoptysis, that is expectoration of blood from the respiratory tract. We need to differentiate this condition from epistaxis, that is bleeding from nose, that can be anterior or posterior, or hematemesis, that is upper GI bleeding. The physiology behind hemoptysis underlies the dual blood supply of the lungs, that is from the pulmonary artery that forms a low pressure system and is essential for gas exchange, whereas bronchial artery that is directly under systemic pressure and is supplying airway. Okay, so in cases there is tumor, the bronchial artery neovascularizes this tumor, also the cavitatory lesion, and the damage to this bronchial artery can lead to massive hemoptysis, and bronchial artery involvement is an important cause of hemoptysis. These two are the bronchopulmonary segments, which are supplied by an individual bronchial artery branch and a pulmonary artery branch, whereas we have an intersegmental vein in between these two segments. Talking about etiology underlying the hemoptysis, the main etiologies can be infective, vascular, or malignancy. The infective etiology, the small amount of hemoptysis can be seen in the cases of viral bronchitis, whereas as we know in the cases of chronic bronchitis, we have thick viscid secretions, because of which there are superinfection with chlamydia mycoplasma, and hence chronic bronchitis with a superadded infection can also lead to hemoptysis. Bronchiectasis is known for massive hemoptysis and death. In bronchiectasis too, we have recurrent infection because of defective ciliary function and dilation. There is airway dilation, inflammation, and highly vascular channels are formed that leads to massive hemoptysis and death. Tuberculosis is one of the important causes in developing countries for hemoptysis. The two reasons we see hemoptysis in cases of tuberculosis is a cavitatory lesion that is formed in the tuberculosis, secondary tuberculosis, and Rasmussen aneurysm, that is pulmonary artery erosion that is seen in tuberculosis. The cavitatory lesion can also be seen in cases of endemic fungi or non-tuberculous mycobacteria that can also lead to hemoptysis. Other causes can be pulmonary abscess and necrotizing pneumonia. So important infective causes are tuberculosis, bronchiectasis, chronic bronchitis with a superadded infection, and a viral bronchitis. In the vascular causes, one of the important causes pulmonary edema, which is characterized by a pink and frothy sputum, but also here hemoptysis can range from mild to massive categories. Pulmonary embolism is generally known for its other feature like acute onset of dyspnea and other feature of CNS and hemorrhagic manifestations. But in cases we have pulmonary embolism with pulmonary infarction, we can see hemoptysis. In cases of aneurysm of aorta, if or pseudoaneurysm of aorta, if aortobronchial fistula are formed, they may be a reason of hemoptysis. And diffuse alveolar hemorrhages involving the parenchyma that can be seen in cases of SLE or cocaine inhalants or other inhalant use, or pulmonary renal syndrome or Goodpasture's disease where anti-GBM antibodies are formed, are important reasons for hemoptysis, important vascular reasons. So important vascular regions include pulmonary edema, pulmonary embolism with infarction, diffuse alveolar hemorrhages, and Goodpasture disease. Malignancy, bronchogenic carcinoma of any histology, can be responsible for hemoptysis and is an important feature of bronchogenic carcinoma. Typically, the central lesions of small cell cancer and squamous cell cancer involve the major vessels and leads to massive hemoptysis. Pulmonary metastasis from different tumors from ovary, lung, stomach can in varying degree involve the lung and can lead to hemoptysis. Kaposi sarcoma, that is seen in the cases of HIV. Okay, it can involve anywhere between oral cavity to bronchi and can lead to hemoptysis. Mechanical and other causes are last to be understood for the hemoptysis. One of the important And less known reason is catamenial hemoptysis, that is pulmonary endometriosis seen in females leads to cyclical hemoptysis. Foreign body aspiration can lead to irritation and further bleeding from the airway. Diagnostic and therapeutic procedures like bronchoscopy can also lead to hemoptysis. And at last, patient with coagulopathy, thrombocytopenia, or under antiplatelet therapy, even with a minor insult, can lead to bleeding. So these were some causes that we had studied about hemoptysis and physiology behind hemoptysis. In next video, we are going to understand the evaluation and management of a patient with hemoptysis. Thank you.